Hi, everybody. Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center. And I thought I would cover a very interesting subject since research just came out. Matter of fact, MedPage sent this out on May 13th, and it had to do with insulin resistance, in effect diabetes, and its tie-in with fibromyalgia. Thus far, they mentioned that treatment for fibromyalgia was, for the most part, symptomatic relief or symptomatic directed, and had nothing as far as the connection of the condition itself. So what they actually did was researchers out of University of Texas, Galveston, Dr. Papaloma, I believe his name was, actually did some research. Insulin is very, very interesting. A research program that they did had to do with those that were insulin resistant. Now, you've got a couple different forms of sugar problems, shall we say. You've got diabetes type 1, type 2, hypoglycemia, which is directly tied in with diabetes, even though it's the exact opposite. Diabetes is, of course, high blood sugar. Hypoglycemia is low blood sugar, but it's also complicated. It's a complication of diabetes. When you take insulin, it's a common side effect to get hypoglycemic or low until things are balanced out. Whereas there's two types of diabetes. One is the insulin dependent, and the second one has to do with hypoglycemia, really, believe it or not. And it has to do with really lifestyle changes and food. And we've talked about that numerous times. And I'll be talking about it also in this talk to help differentiate different things. Now, insulin resistance, they say, is pathogenetically linked to fibromyalgia. That's what the early tests have been, research has stated. However, you have to understand that the research that was done was only with 23 patients, 23 patients that were insulin resistant, most of which were women. And so what they did was they actually checked to see whether or not a medication would work. And they used metformin, which is common as far as diabetes is concerned. It's a common drug that's used. And they found that 50% of those patients that actually took the medication, their pain was gone. And so they're thinking that metformin is the answer for fibromyalgia. Now, metformin side effects have a number of things to do with fibromyalgia. Again, dizziness, lightheaded, yeast infections, both female vaginal and male penile, kidney problems. You can get urinary tract infections, or if you have urinary tract infections, you should stay off of the problem. Nauseousness, vomiting, tired, shortness of breath. Hypoglycemia. And hypoglycemia side effects, of course, are headache, drowsiness, and weak, dizzy, hunger, things of this sort. So they tried to get an established association with fibromyalgia. Again, I said it was a small group, 23 people, ranging in age from 35 to 60. And the A1C levels were higher than two other independent control groups. In this Dr. Pepola, an MD, PhD from University of Texas, Galveston. So what they did was they treated the people, like I say, with metformin, a common diabetic medication, and again, 50% stated that there was remission of pain. Now, you have to understand, insulin resistance causes dysfunction in the brain, and this is also found with fibromyalgia patients. Fibrofog, okay, difficult concentration, so forth and so on. So all of those things kind of rhyme together, so to speak, along with many of the other 15 that I mentioned, in effect, as far as symptoms are concerned. So you have to understand that we've been talking about this for decades. Dr. Saint Amand found that the vast majority of fibromyalgia patients were hypoglycemic, an offshoot of diabetes. Of course, low blood sugar, but oftentimes caused by diabetic medication. And so he actually coined a term, fibroglycemics. We actually place our fibromyalgia patients on a hypoglycemic diet. I place mine on a restricted hypoglycemic diet. If you look at a hypoglycemic diet, and I've covered this before, you'll find that there's liberal and strict. Now look, if you had a choice between liberal and strict diet, You're going to go with the liberal, right? Very few people are going to be engineer type, are going to follow it exactly down the line, okay? They don't do that. What they do is that if they can cheat a little bit and get away with it, that's what they do. So a regular hypoglycemic diet includes things that I would not have on it if I had hypoglycemia. So what I did in our treatment is I replaced a number of things on the hypoglycemic diet, along with the restriction of sugar, gluten, trans fatty acids, dairy. Sugar, all forms of sugar except for stevia, gluten, which is wheat, rye, barley, malt, trans fatty acids, which is omega-6, just anything that you can find on a shelf that has a shelf life in a box or a bag or something, and any red meat and pork. Now, in the old days I'm talking about back in the caveman days, that meat had high levels of omega-3. However, because we kept on feeding all of the animals, all of the grain, they lost their omega-3, and now most beef and pork is omega-6. Why is that important? Because it stimulates in the brain something called arachidonic acid. Arachidonic acid then produces prostaglandins. Prostaglandins is your primary source of inflammation and pain in the body. So you're adding actually gasoline to the fire if you eat this, okay? So sugar, gluten, trans fatty acids, dairy, not just milk products, but don't forget the cheeses. I had a patient who was doing wonderful, except she just couldn't seem to get over the hump. It just seems as though she plateaued out, and I kept on going over with it. She said, I don't think I'm ever going to really get back to normal. And so I kept on asking her questions. I said, what's involved with your diet and so forth and so on? Are you eating something that maybe snuck into your diet you shouldn't be having? I said, I went through all of just like sugar, gluten, trans fatty acids, dairy. No. And all of a sudden she had this long pause, and she kind of looked at me and she said, oh boy. She says, when I prepare food, guess what I do? She says, I nibble on cheese. She says, you don't suppose. I said, that's a dairy item. And so she went off of that, and now she's a totally different person. One of those people that really, really responded exceptionally well to fibromyalgia. There's always something hidden, I find it, with fibromyalgia patients. Whether it be a secondary condition or possibly something that they're eating that they shouldn't be eating. But anyway, so we knew about this information decades ago, how hypoglycemia is very, very important as far as if it's not treated with our regular fibromyalgia protocol, the patients oftentimes will fail. And so obviously people are not checking into our protocol that have research validity. Why they're not doing that? Well, maybe it has to do with the fact that metformin is a pharmaceutical. Hey, I'm not saying that it's a definite, but of course metformin, it's a pharmaceutical. And I just mentioned to you, you're going to have side effects, okay? And while they're taking metformin, you're going to have highs and lows in your sugar, blood sugar, and so oftentimes that triggers hypoglycemia. Does that mean everybody that hypoglycemia has diabetes? No, but it could be something, maybe even a precursor to diabetes, so you have to watch that, so to speak. So Dr. Saint Amand decades ago mentioned this. If you want to read any of his books, you can. I've place it in our protocol so that we have patients that are treated for this before they get on our protocol. Why start something if they're going to have a problem with it as they're going in a protocol? It's just going to be another door that they have to sort of knock down before they start improving. So anyway, that's some very important information for you. The research is out there. Hey, if you want to try metformin, guess what? It's another, just like they say, it's just another symptom-directed medication. It's not a condition-related medication in itself. Matter of fact, they're checking this now. They're going into things like people that have post-knee surgery that have continued pain. They believe there might be some insulin resistance, so they're looking into maybe giving these patients metformin. I'm trying to contact a patient of ours that had had knee surgery and still having pain. She may be having this problem. She doesn't even know about it. And also low back pain, lumbar spine, and osteoarthritis. They're checking to see if these patients are insulin resistant, also to see whether or not they should give metformin. So, but to just jump at the point and say insulin resistance is pathogenetically linked to fibromyalgia, I think with a group of 23 people might very well be jumping off a cliff to see whether or not the water is deep enough when you land. But if it helps symptoms, I'm always for that. Except, again, watch what you're taking. Watch the medications that you're taking. It's very, very important that you understand that every medication, every pharmaceutical has side effects. And those side effects can cause long, enduring additional symptoms or new symptoms, or just really get in the way of having the patients that have fibromyalgia improve. I've gone over and over again all the different symptoms that fibromyalgia patients have. And you really have to look at the side effects. I just had some surgery about 10 days ago, and they put me on something for antibacterial. And sure enough, I said, I better check and see what's going on, see if there's any side effects. I'm finished with it now, and hopefully half-life will make a difference as far as, sorry, my apologies, I forgot to turn the phone off. I try to make myself available all the time with as many patients as I can, unless I'm with patients. And so my apologies for leaving that out. But anyway, so I checked my medication, and it sure causes tiredness, irritability, itching, scratching, things of this sort. Nothing too major, but yeah, I am itching, and I've been more tired. I've been trying to get more sleep, but I just have to wash this out of my system. I think that's the big thing. I wash it out of my system so that I have this tired feeling out of myself. But if it takes care of the antibacterial or bacteria just in case, that's the most important thing that I have. I prefer having a little tiredness in this case rather than having infection. And the side effects are not that great. So, and I only was on it for a couple of days, so that's the most important thing. So anyway, again, if you hear things, if you find things that you read about, I'm not talking about fake news. This is research that they're following up on. Great. But it's been there already. I mean, like I say, most fibromyalgia patients have hypoglycemia, so we treat it. Is it an offshot from diabetes? Could be, or could be hypoglycemia is just separate. But the key is that you understand your secondary conditions. You understand what might adversely be affecting you. All the other conditions that we were talking about before, all the arthritis and rheumatoid and lupus and MS and so forth that really tie in, that have similar symptoms but are not fibromyalgia. They may make fibromyalgia worse, or fibromyalgia may make them worse. After we've taken care of the fibromyalgia, I have one patient who he's at the level where he has no fibromyalgia symptoms, but he has chronic fatigue. And the chronic fatigue still makes him tired. But he has, like I say, waxes and wanes. There will be times in which he comes in. So I feel like, great, super. And other times he comes in, he says, the CFS really got to me. So, but the fibro, we check him and we test him and everything else. The fibro is gone, controlled, everything. Fantastic. It's just the secondary conditions are those things that linger, so to speak, and cause patients to wonder whether or not they're ever going to get better. Well, in many cases, just by staying off of those things I gave you that are inflammatory, those will reduce the symptoms that you have on osteoarthritis and many of the other ones that might just be adding, like I say, gasoline to the fire. So don't do that. Anyway, Ken Muich, Stetson Chiropractic, Dr. Ken, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic, where we're here to help you, prospective patients, put it this way, sent in to me a letter explaining all of her symptoms and so forth. Please help me, so forth and so on. And I've tried to email her, phone call, do all sorts of different things. And hopefully she gives us an opportunity to try to help her. She has severe fibromyalgia with a lot of other secondary conditions. And so that makes it even worse. We're here to help you in any and every way possible, even if it's just to explain to you what you have and how we might be able to help you. Keep in mind, Stetson Chiropractic Fibromyalgia Wellness Center, it's not a chiropractic treatment, it's fibromyalgia. And so we treat that accordingly. Don't be afraid to look up our information, Fibromyalgia Wellness Center, for a website. Also, you can call. The clinic number is 480-948-4955. Look, if what you're doing isn't helping, there's no reason why you should be suffering. Give it another chance. Give it an opportunity. We'll give you patients you can call and talk to them, see how wonderful they're actually doing, because we treat the condition, not just the symptoms, okay? Again, hope to see you next Monday, same time, 12:30 p.m., Fibromyalgia Wellness Center, live video. Tell your family, friends, doctors, so forth and so on. More than willing to answer your questions, do whatever we need to help you. Thank you very, very much. Have a wonderful week. Bye-bye now.